Hello, and welcome to the CACFP Training. My name is Angie Prokop, and I am the Nutrition Coordinator for Head Start. CACFP stands for Child and Adult Care Food Program. It is a federal nutrition program under the guidance of Food and Nutrition Services in the USDA. CACFP is a meal and milk reimbursement program providing nutritious meals and snacks to eligible children from infants to 18 years of age. CACFP is utilized in many daycare settings, childcare settings, and after-school programs in Minnesota. Head Start Performance Standards mandates us to use the USDA Food and Nutrition Services Child Nutrition Program as a primary source of funding. Head Start and Early Head Start state and federal grants cover remaining costs that are not covered through CACFP and reimbursements. The USDA is an umbrella agency that oversees food and nutrition services. Our main authority of our state agency is Minnesota Department of Education. Community Action are considered a sponsor agency that manages a multi-site program. Each of our Head Start locations are considered affiliated sites which provide for our children and families. I also want to give a big shout out to each and every one of you that work directly with children and families, as you are the key staff and an integral piece of why CACFP runs successfully in our program. CACFP requires minimum training in specific topics. These topics are meal pattern requirements, meal count documentation, record keeping of daily records, meal service, and special diets and food allergies. Now, we also want to talk about some other required training that is required by our agency or by licensing. ICCPPs are a licensing form that is required for all children with special diets and allergies. We'll be discussing this further in the slides. I also included some COVID updates of how we are adjusting our program based on the flexibilities and the waivers that the USDA has given for CACFP. Additionally, we'll talk about some of the changes that happen in nutrition activities and family style meals due to COVID. And then lastly, we'll talk about some policies and procedures. I understand with all the uncertainty, meal schedules may be a question on your mind. For Head Start Performance Standards, if a child attends less than 6 hours per day, we are required to provide 1/3 to 1/2 of their daily requirements each day. If a child attends more than 6 hours, we are required to serve 1/2 to 2/3 of their daily requirements each day. So, for children attending the 5-hour day session, we have to provide 1/3 to 1/2 of their daily requirements. For children attending university, they have to have 1/2 to 2/3 of their daily requirements. University schedule has not changed one bit as far as meal times go. However, children attending the 8 o'clock session, they will receive breakfast, lunch, and a take-home snack. Children attending the 9:30 session will receive an AM snack, lunch, and take-home snack each day. One of the things I want to highlight is that we'll go over a little bit later in this presentation is some USDA flexibility waivers that allows us to send home snack with the children and claim that snack on the meal count still. Additionally, our AM snack is a new meal schedule that we've never worked with before. It is a CACFP requirement that for children attending childcare, you can either serve them 2 meals and 1 snack or 2 snacks and 1 meal. So for the AM snack, it will look very similarly to what the breakfast is each day also. Lunch times for the 5-hour day program may be adjusted to fit the center schedules, but we want to try to keep them within close proximity of each other. However, if it works best for program needs, we can definitely change the meal times up. Meal pattern requirements details meal components and portion sizes that we need to offer each child in our program. This information is based on the dietary guidelines from the USDA to have a balanced diet and help meet recommended serving sizes for each meal component. Portion sizes are going to differ based on what meal or snack we're serving and also based on what age group we're serving. One thing that I want to note is that when it comes to milk, we have to serve a fluid milk. It cannot be any dairy product based off of like yogurt or cheese. It has to be fluid milk. And we'll go over about some of the substitutions a little bit later when we talk about special diets. Additionally, under a CACFP recommendation, they want us to serve 8 ounces of milk instead of 6 ounces of milk. So that means each child will get their own carton of milk. So for breakfast, we have to serve at least 8 ounces of milk, a half a cup of fruit or vegetable or juice, a half a serving of bread or grain. For lunch, 8 ounces of milk, 1.5 ounces of protein or meat alternate, a quarter cup of fruit, a quarter cup of vegetable, and a half a serving of grain. And then for snack, we can choose 2 of the 5 components. However, both components cannot be liquid, so we can't serve juice and milk. But we can choose 2 of the 4 or 5. 8 ounces of milk, a half a cup of fruit, a half a cup of vegetable, 1 ounce of protein or meat alternate, and then a half a grain. One other thing that I want to note is that every child has to have at least 1 whole grain rich serving per day while in center. And whole grain rich means that more than 50% of that food product is made with whole grain foods. For toddlers, it's going to look very similarly as what we have for our preschoolers, but in different portion sizes. We will only be serving toddlers 4 ounces of milk, and that is 1/2 of the cartons that we serve. Then they need to have at least a quarter cup of fruit or vegetable or juice, and then a half a serving of bread or grain. For lunch, it's 4 ounces of milk, 1 ounce of protein or meat alternate, 1/8 of a cup of fruit, 1/8 of a cup of vegetable, a half a serving of grain. And then for snack, we can choose 2 of the 5 components again, either 4 ounces of milk, a half a cup of fruit, a half a cup of vegetable, 1 ounce of protein or meat alternate, and then a half a serving of grain. Some items are going to be modified on the menu based on the developmental needs of the toddlers. Each of these meal charts can be found in Child Plus, and these should be posted in the classroom based on what age group you're serving. Creditable foods are foods that are counted as a required meal component as part of a reimbursable meal. All main meal components need to be creditable to be a reimbursable meal. Non-creditable foods may provide vitamins and nutrients that can be on the menu, but it can be considered an extra and not as a main meal component. Those are items like condiments, pickles, something that might go with the meal. In order to be creditable, foods must meet specific guidelines. As a sponsor, we have to maintain nutritional information for each of the meal components served. This information may be a child nutrition label or product formulation statement from the manufacturer, and that tells us exactly how much of a meal component is in their food item. Other items we need to maintain records of are that whole grain rich foods like I mentioned in the previous slide. In order to be reimbursable, all main meal components need to be creditable. They have to be offered in the minimum portion requirement, and the menus have to accurately reflect what is being served. So if there is a menu change, you can either post up the email that I send about the menu change, or you can write it in on the menu in your classroom. CACFP updated their meal pattern requirements in 2017, and there were some changes that affected of what foods are creditable and what foods are not. I know we talked about the 1 serving of whole grain rich foods must be served at least once per day per child, but additional things are that we can only credit 1 serving of juice per day per child. So if they have juice for breakfast, they cannot have juice for snack. Also, grain-based desserts are not creditable. Those grain-based desserts might look like a cookie, a cake, brownies, whereas, for instance, we used to have a menu item a couple years ago called the breakfast spread on the menu, and that was too much like a cookie, and so we were unable to maintain that item on our menu. Foods also have set guidelines for sugar intake and cannot exceed specific grams of sugar based on that food item. Protein can be used as a grain substitute up to 2 times a week for breakfast, and tofu and whole soy items are now able to be counted as protein per CACFP. Attendance for CACFP is required, and it's fairly basic for CACFP. They require you to take attendance to let us know either the child is present or absent. One of the things I want to let you know about, though, is with the meal counts on the paper attendance that you'll print out, your codes are going to look very similarly to what the codes are for attendance versus meal counts. So you have, under attendance, you have P equals present, A equals absent. Under meal count documentation, A will be AM snack, P is PM snack, B is breakfast, L is lunch. Head Start performance standards have different requirements when it comes to attendance, and so you will receive more in-depth training on attendance from Jake and his ERC team. But remember to always hit save whenever you are done filling out any information on Child Plus. Meal counts are taken through Child Plus also. You will not be able to claim a meal for a child that is not present. Your meal counts may never be more than how many children you have present, but it could be less. And that might be that maybe a child left early, or maybe they didn't want snacks or breakfast or something, so they didn't come to the table, and that's okay. And I don't need you to document why the child didn't have a meal count. However, there will be other documentation that you might need from Jake for attendance. Meal counts are required to be completed at the point of service, and the point of service can be defined as any point during the meal when that child is offered the food at the table, before they get up off the table to clean up. We also kind of know it as butt in chair. So when that child's butt is in the chair and the food is offered, we can count that child as meal count. Also, the food has to be present in the room in order for it to be counted, and on the table, It has to be present in the room and on the table for it to be counted as offered to the children. Meal counts may not be taken when children are washing their hands, before they sit at the table, or after all the children have left the table. I also want to note too, as a safety hygiene practice, is that after the children wash their hands, they should not go back to a circle time and sit on the floor. Then their hands are dirty again and they would be needing to rewash them. So another time, remember to hit save. Hit save as many times as you can. You won't hurt the program. Additionally, if you receive any error message stating that the child is not participating in CACFP, let me know and I will fix it. Child enrollment forms are documentation to ensure we do not claim children who don't exist. This form was created by CACFP because programs were claiming children that were not enrolled in their program, trying to make money off of CACFP. This form is to be filled out prior to the child starting, and it's completed in one of two ways. So the page that's on here now is a form that is generated by Child Plus and printed out, and the parents can verify all of the information per the child and sign the form. Only one parent or guardian needs to be signing the form. This is the other form, and it's a blank copy that staff and families can fill out together. And this is the form that will be primarily used currently because we are able to upload it to the Alpha Trust software to complete orientations virtually, where families can sign virtually. CACFP wants to make sure we are not claiming meals for children who are not enrolled and who do not exist. A couple of the things that I want to add that are new is that we'll be only collecting one form per child for the whole year, even if they change program options or centers. Also, the information will be uploaded into Child Plus with other orientation paperwork to track easier and ensure information is all located in Child Plus. When a family notifies us of a special diet, food allergy, intolerance, or preference, we need to have a few items in place prior to the child starting. The Special Diet Statement, or SDS, is required for all children to have an identified allergy, intolerance, preference, or diet need. This form requires a doctor's signature for all allergies, intolerance, and special diet need. However, this form does not need a doctor to sign if a family has a food preference for their child. Food preferences could be cultural, religious, or family-based. We can also use a physical if it details what the child is allergic to as a source of information from the family that's signed by the doctor. We still want this form signed and we can attach it to the physical, mostly because it, one, tells the families that we are participating in CACFP, and two, it also has their authorization that we can substitute a menu item for that child when it appears on the menu. We do not need to have this signed by a doctor when a child has a food preference or religious preference, but we still want this form signed by the parent and sent to me, like I said, so that gives them the authorization to us that we can provide a different menu item to their child at school. So preferences could be that they don't eat beef or pork per religion. Maybe they choose to be vegetarian, or they choose to drink a non-dairy milk. We are not able to use coconut milk or almond milk as a milk substitute because it doesn't meet the USDA guidelines for nutritional standards. And there is a specific list that CACFP puts out that says that these are the items that meet their requirements and that we can use them. CACFP has actually created or found a new non-soy milk that is creditable and non-dairy. It's from peas, as in like sugar snap peas or pea shoots. But so there's pea milk that is creditable. We're not able to provide that yet because it's really hard to find. If families request a milk type that is not creditable, we would not be able to accommodate that request. There is a few other preferences that we are not able to accommodate based on our program operations and based on USDA requirements. For example, we are not able to accommodate a completely vegan diet. We can accommodate a vegetarian diet, but we cannot go completely vegan based on what is required to serve for meat alternate for the USDA. Additionally, we are not able to provide to a kosher diet. With a kosher diet, there is requirements for keeping your dairy and your meat separate. That means separate dishwashers, separate plates, separate refrigerators, everything, and we just do not have the capacity to do that. I would also like to note that even though we are peanut safe, children who have a peanut allergy should still have a diet statement, an emergency care plan signed by the doctor, and an ICCPP on file. We do not need a diet statement for families that preference is to not eat pork. We do not serve pork or any pork byproducts. But if there are other diet needs for those families, we do need this form filled out. An emergency care plan is required for all children that have an allergy or when their diet need requires medical attention when the child comes in contact with the food item. The emergency care plan will be discussed in further detail with the health team. An individual child care center program plan, or ICCPP, is required for all allergies and intolerances. For food allergies, we need page 2 and 3 filled out, which is highlighted in these two slides. An ICCPP is a parent report of allergy and does not need to be signed by the doctor. This form is a licensing requirement that needs to be kept in the kitchen, the classroom, and I also need a copy. The ICCPP requires specific information about the child's allergies, which are triggers, avoidance, symptoms, response procedures, and then additionally medication, healthcare provider, when the plan was created, reviewed, or modified. Every single staff or adult that will be in the classroom or working directly with the children in the classroom is required to review the form and sign it. If the child has multiple allergies, licensing states one form per allergy. I do want to also enhance or talk in depth. We do need a copy of this in the kitchen, in the classroom, and then I'll keep a copy of it. So I'm going to jump ahead to the special diet list real quick. As you can see on this form, it says SDS completed, center has a copy, ICCPP, copy of ICCPP to nutrition coordinator. These are methods that we're going to use to track to make sure that we have the required information. So for the menus, though, the menus will include or list and identify 4 of the 8 main allergens to help you know what is in the food. The 4 allergens listed are dairy, soy, wheat, and egg. These are all allergens that can appear in food also. While the other 4 are not listed, they are items either that we do not serve or they are most common seen in whole form. This can be helpful if you have questions if one of your children in your class can eat something or not. There is no designation of an allergen behind the menu. It means that the food item does not contain one of those main allergens. However, if you have a child that's allergic to pineapple, it will not be identified on the menu as an allergen, but will appear on your SDS list for the classroom. In additional comments, you may also see notes such as eggs in foods okay or dairy in foods okay. This is used to provide you with some additional information to know the child's diet better. So each classroom will receive one of those special diet statement lists that is shown here. And it needs to be posted and available, but it needs to be covered up to comply with HIPAA guidelines. If your classroom does not have any children with diet subs or diet needs, you still need to have this form available, and it needs to state that there are no diet needs in the classroom. The diet list will have the child's name, the date of birth, the center, classroom, what type of diet it is, so if it's an allergy, intolerance, preference, or special dietary need, what foods to avoid, what foods to serve, additional comments. And then again, those check mark boxes that I mentioned to ensure that we have all the paperwork we need. Lastly, when you receive a diet substitution in the classroom, it'll come in a brown paper bag or it'll come separate from the rest of the food. And it has to be labeled specifically per licensing because it cannot have the child's name on it because other people might be able to see that. So it will be labeled with the child's initials, the class, the meal, day, what to avoid, and what to serve. So we talked about the main 8 allergens and at least 4 of them. Milk, dairy, eggs, fish, shellfish, wheat, soy, peanuts, and tree nuts. It is important to note that there are foods that have cross-reaction to some of these main allergens also, such as chickpeas and garbanzo beans. They have some cross-reactions to peanuts. Coconut has cross-reaction to cashews. And then just another one that you might know about is that kiwi and latex also have some cross-reactions. Symptoms of allergic reactions can include hives, flushed skin, tingling of an itchy mouth, swelling in the face, tongue, lips, or throat, vomiting, diarrhea, abdominal cramps, coughing, wheezing, dizziness, difficult breathing, and loss of consciousness. If a child starts having an allergic reaction, you should follow the emergency care plan, contact Cheryl, parent, and myself if it's food related. We know some of the children in our care may not have tried certain foods that we are serving, and there's really no rhyme or reason of how allergies appear. So, if you notice a child is having an allergic reaction to food, but they do not have an identified allergy, call the parent and Cheryl, monitor the symptoms, and call 911 if the child starts having difficulty breathing or loss of consciousness. So as I mentioned earlier, that CACFP has had some flexibility waivers that changes how we can provide services in our program. So the non-congregate feeding waiver allows us to provide meals outside the school setting. So with our children that are attending virtual services, they will receive meal bundles that we'll be able to claim breakfast, lunch, and snack for each of those children for each day that they would have normally attended in-class sessions. Also, this changes in family-style meals of where the adults will be responsible to serve all the meal components. And this is also the waiver that is allowing us to provide snack to our in-class session to take home and for us to be able to claim it still. The parent and guardian pickup, this basically just says that the children do not have to be present for the parent or guardian to pick up those meal bundles from the school for their child. The meal pattern flexibility waiver, this is the only waiver that we would actually have to apply for previously. And this means that if we are missing a meal component due to COVID impact, that we can file this waiver to still claim the meal as full, even with missing a required meal component. And then the monitoring requirement waiver allows us to complete monitoring virtually. So I will be working with the CECs of how we can effectively plan a monitoring visit for the center that still makes sure that we are running CACFP with integrity. The nutrition activities will be suspended for additional activities. However, we will be putting together some monthly nutrition activities provided by nutrition that will be sent home to the virtual service children and provided in class for the in-service classes. Activities will be modified to follow that COVID-related practices and with the center plans. And all activities will be individual. So you won't be able to mix things together, or children won't be able to mix things together. One of the activities that we did in the summer school program to kind of see how this would work out was a trail mix. And we called it the friendship trail mix, and that the children were able to identify which items they wanted to add to the trail mix. And then the teacher would add it into a bowl, and they would be responsible to serve the trail mix to all the children. Minnesota Department of Education Food and Nutrition Services comes to review our program every 3 years to ensure that we are following requirements. They look at all our documentation around food items, portions served, attendance, meal counts, training records, and fiscal management. They also want to watch meal times at the center, and this is very similarly, and actually the same form that I use when I watch meal times at the centers also. When findings are identified, corrective action is noted, and there needs to be an implementation date, and follow-up needs to happen to ensure corrective action was implemented properly. Monitoring requirements for sponsors, that's us. So our monitoring requirements is that we have to plan 3 visits annually with no more than 6 months between visits. Additionally, 2 of the 3 visits must be unannounced. With that meal pattern, or with the monitoring waiver, we will be looking at how we can still be in the classroom with following the center plans for COVID also. Usually we have to go into every single classroom, but since the COVID center planning is recommending no more than 2 classrooms being entered in a day, we'll have to be more creative about how that is being done. Postings that are required in each classroom include the CACFP meal pattern that I told you, the My Plate, mealtime procedures during COVID, menus, hand washing, and choking posters. Postings required in the center include the Justice for All, Building for the Future, WIC information. And then in the kitchen license has to be posted. The current MDH or Ramsey County licensing visit summary needs to be posted. Food allergy poster, food temperature logs, refrigeration temperature logs, illness documentation, and then additionally, they also have to post their Serve Safe or Food Manager certificate. Just a couple of other little items to act as a reminder that when we are putting food in the classroom, all items must be placed on the table to be considered offered for the meal. So that's even those individual items. Milk has to be on the table, the grain has to be on the table. If it's snack or if it's breakfast, the cereal, milk, and fruit need to be on the table. And also water must be available to children throughout the day. Water may be served at meal times after milk has been offered, but also water could be provided through the classroom if there is no potable water or drinking availability in the classroom. We will provide pitchers of water to each of the classrooms, and when they are empty, you can bring them back to the kitchen and we will refill them. So family style meals, COVID practice, family style meals are going to be modified to limit contamination and to follow the COVID center plan. This is the My Plate poster that I mentioned that should be posted up in each of the classrooms. It uses visual items of how to look at what a plate should look like. And you can see that grains and vegetables have a bigger pie than the fruits and protein. And that's to show that consumption of vegetables and whole grains are more than fruit and protein, or should be more than fruit or protein. And this is based on nutrition information from the daily recommended dietary. So the procedures for meal times COVID is a summary of CACFP, Head Start Performance Standards, and CAPRW practices. This is posted in each classroom and can be used as a quick guide for any new staff and volunteers. And this form, along with nutrition forms, can be found in Child Plus to print off. So when we talk about family style meals, there's 4 components of family style meals. The first one is table setting. Typically, the children would have participating in table setting, but due to COVID, children will not be allowed to set the table. The adults will wash your hands, wear your gloves while passing out any items relating to the meal service. This is including food. Classrooms will not be able to store any of their paper supplies in the classroom, and it will be counted and set out for portions of 12 servings per room by the kitchen staff and brought to the classroom with the meals. Any unused paper items from the mealtime will be disposed of. Children should be limited to 4 to 5 children per table with 1 chair space between each other. We have noticed that some classrooms in the summertime thought it was easier to remove those unused chairs. And then a couple classrooms liked having it because it helped with children identify where they could and couldn't sit. Whatever works best for your classroom, you can choose how that looks for you. When it comes to serving the food, children will not be able to serve themselves at all. Adults will wear the gloves and you will serve each of the items to the children. Minimal portions are required to be served and portions are reflected on the menu also. We are going to look at purchasing those serving utensils that are pre-measured to 1/8 cup, 1/4 cup, 1/3 cup, and 1/2 cup to provide you with the tools to ensure minimum portions are served. Now, one of the things I want to note is that if a child still does not want a food item, they can refuse it. You do not have to put it on their plate. So if a child says, no, I don't want those green beans, that is fine. But if they say, yes, I want those green beans, you have to serve them in that meal portion requirement. Conversation and dialogue is one of the areas of the meal times that really haven't changed. We want to continue to engage children during the meal times through conversation and encouraging healthy eating habits. However, all topics do not need to be about nutrition. We can talk about other things that you are doing in the classroom, maybe on your lesson plan, activities that you did in the classroom, books that you read. You can also talk about nutrition, about what items that is on the menu, what meal component it falls under. You can ask the children what the family eats at home. And then also you can use dialogue for cues of being full and teaching the children self-regulation. Children are expected to clean up those place settings, and all unserved foods will go back on the cart and sent to the kitchen. The kitchen staff will dispose of the foods and make sure all of the mealtime servingware is cleaned and sanitized properly. And then in the classroom, you will clean and sanitize your tables and chairs using the 3-step method before and after each of the meals. One of the things I want to add, and I know that this happens at least one of the centers, it might happen at others, is that staff tend to make their lunch off of the food that comes back from the classroom. We are highly discouraging this as we are trying to maintain classrooms keeping with their own classrooms as kind of like a family. This includes our drivers, our monitors, all of the teachers. So if that food came from another classroom and that you're not working with that classroom directly, you could be contaminating the other classrooms. So we are strongly discouraging any staff to eat food off of the trays when they get returned to the kitchen. With all of the modifications, we still want to foster independence with the children. We are still enhancing our social and language skills. The children are still going to use the utensils to help develop their motor skills. We want to create a positive view of meal, about eating, about themselves. We can have promoting peer acceptance of foods. We can talk about table manners, and of course, teaching the children about food and healthy eating. These are all advantages of family style meals, that some of this happens without any practice. It just happens as the year goes on. I said it earlier and I want to say it again, but you guys are really the ones that are doing the hands-on work to make CACFP and family style meals successful. As some of you know, we had changed our sanitizing and disinfectant chemical last year when COVID hit. We were using a quat sanitizer in the classroom and a bet one or fight back in the bathroom for disinfecting. We will be using a bleach solution for both sanitizing and disinfecting in the classroom for table washing and chairs. The disinfecting bleach solution is only used when needed and when it's determined on that chart that will be provided each of the classrooms of what to sanitize and what to disinfect. The process is still very similar though. So you'll spray the surfaces with the soap water and you'll wipe it down. You'll spray the surfaces with the rinse water and then you'll wipe that down. And then you'll spray the surfaces with the bleach solution, either the sanitizer or the disinfectant, and you will allow that to air dry. It has to be in contact with the surface for at least 2 minutes to sanitize or disinfect completely. One of the other things is that all chemicals should be locked up and out of reach of children at all times. The bleach solution must be changed daily. And then also, you will receive 2 pitchers for each center, one for the bleach sanitizer and one for the bleach disinfectant. Each of the pitchers will have the directions of how to mix the solution and what the strength should be on, along with a test guide to tell you what strength it should be at, or what strength it is at, I should say. So for mixing the sanitizer, you will put in cold water in a gallon pitcher that we'll be providing and 1 tablespoon of bleach. You want to mix this up with a spoon or even like the trigger of the spray bottles. We'll also be providing you funnels for easier pouring into the spray bottles. The chlorine test strips should be at a level between 50 to 200 parts per million. For the disinfectant, it's very similar. However, you're going to be using more bleach, and that's 1/3 of a cup of bleach per 1 gallon of cold water. And the test strips should be reading between 500 to 1,000 parts per million. One of the things I want to emphasize with the disinfectant solution with the bleach is that it can damage clothing with how much bleach is in that water. So you do want to be careful that you are not spraying it around people that are, can't damage their clothing, or like on the playground equipment. You can use the bet one or the fight back for that. But this is specifically talking more about table washing in the classroom with your tables and chairs and what to be used in the tables and chairs. A height and weight screening is required for all children. The child's physical is used as a primary source of that screening, but when the child does not have the physical and no screening has been completed, I will send the CEC a list of all the children who need it completed still. When measuring the height, you want to record the height to the nearest 1/4 inch, and that's 0, 0.25, 0.5, or 0.75. And please document using height as inches, not as centimeters. And then when measuring weight, children should remove their shoes prior to stepping on the scale and record the data as it appears on the digital scale. And if you're using one of the other weighted scales, you have to calibrate it and adjust it down to 0, and then the child can stand on it, and you'll use that and document the weight to the nearest 1/4 pound. Lastly, heights and weights are usually done at part of orientation. There is some weight requirements when it comes to which safety seat that they're using on the bus, whether they're using an infant seat, a star seat, or a harness. So that concludes my CACFP and Family Style Meals training. So there will be a quiz that is connected to this training, and you'll receive a certificate after the quiz is finished. However, if you have other questions that you need to have answered, please feel free to contact me. My name is Angie Prokop, and that's aprokop@caprw.org, or you can call or text at 651-983-6378. As a management team, we have started to look at different ways to answer questions from surveys and from trainings that are being done online. One of the ways that we're going to be doing is that we'll be having a Zoom training wrap up after the pre-service training is completed. And so all of the questions that you submit to me will be addressed at that time. Additionally, we'll be putting out an FAQ that will be sent out to all the staff that they can access to see all the questions that were asked about the training and the answers about it. But please feel free to call me or text me or email me with any questions, and I would love to hear from you. Thank you and have a great year.